Well, good afternoon. Thank you for joining our broadcast, Maximizing Outcomes. Where there are so many possible courses of action, how do you identify the vital few that will have the greatest impact? This broadcast is sponsored by JBS International, and since its foundation in 1985, JBS has worked to change behavioral health service systems and improve lives. We serve clients in the public and private sectors by helping them solve complex problems to improve the human condition. And here at JBS, we put our clients first and tailor our services to best meet their needs. First and foremost, before we go to the presenters, we want to be sure that everyone is hearing a clear broadcast and knows how to participate. If you are having technical difficulties, please send a message using the chat function to Beth Araya for support. We encourage you to submit your questions and comments at any time during the broadcast by selecting all panelists at the drop-down menu in your chat window. And to open your chat window, just look for that chat icon at the bottom center of your WebEx window. And the phone lines will stay muted the entire broadcast to ensure a clear recording of this event. Although we're unable to facilitate a live Q&A today, we will respond to all questions submitted following this broadcast. I'm also required to disclose to you that this webinar is being recorded and that by participating, you are consenting to this recording. We do request that everyone participate in a short satisfaction survey that will appear in a pop-up window once the session ends and you've closed out of the webinar. Thank you in advance for your participation in the survey, which helps us continuously improve our services to you. So without further delay, let me introduce our presenters. Our presenters will tell their story about the course of action they took that ultimately led to the achievement of outcomes. The first presenter, Angie McKinney-Jones, has a master's degree in social work and over a decade of experience developing and directing substance abuse and mental health prevention, early intervention, and early childhood systems. Her work includes helping others use data to understand problems and design solutions that achieve significant outcomes. While Director of Substance Abuse Prevention for the state of Tennessee, Angie led efforts to strengthen multi-agency partnerships and improve workforce development, data, and evaluation systems. At JBS International, she's involved in helping states and communities use performance management processes to improve outcomes across the lifespan. Angie is located in Nashville, Tennessee. You'll also hear today from Lori Barger-Sutter. Lori is nationally recognized, and she is an award-winning social architect who has nearly 3 decades of experience helping states and communities develop vibrant, cross-sector partnerships that can significantly improve social problems and health outcomes. Prior to JBS, Lori led a state system transformation that developed frontier, rural, tribal, and urban partnerships and significantly decreased substance abuse and related problems. She has worked across sectors in community and regional planning, education, national service, and public and behavioral health, and her areas of expertise and focus at JBS for the past 10 years have included organizational assessment and development, partnership and systems approaches, strategic planning, public policy, and sustainability. Lori is located in Lincoln, Nebraska. Christy Schmiege has a master's degree in public health and over 30 years of experience in the behavioral and public health fields. She is currently Director of Integrated Health for Higuera Programs, Inc., and serves as Treasurer of the Michigan Certification Board for Addiction Professionals, and she's the Vice President of the Michigan Department of Health and Human Services Behavioral Health Advisory Committee. She is the former president of the Michigan Association of Substance Abuse Coordinating Agencies and has participated in many local, state, and national committees. At the time of the initiative featured in this presentation, Christy was Director of Substance Abuse Services for Genesee County Community Mental Health, which is now Genesee Health Systems. Lisa Coleman has a bachelor's degree in social justice and has worked in the behavioral health field for the past 19 years. During her career, she has implemented and trained others in substance abuse and mental health programming for families, youth, caregivers, and incarcerated populations. She has also organized coalitions, community events, and media campaigns, and managed both substance use disorder prevention and naloxone provider networks. Lisa is a certified prevention consultant and currently serves as the National Prevention Network representative for the state of Michigan. At the time of the initiative was featured in this presentation, Lisa was manager of prevention services for Genesee County Community Mental Health, which is now Genesee Health Systems. At this time, I'll now turn this broadcast over to Angie, who will introduce the Pareto Principle. Angie?
Hi, good afternoon, everyone. I hope you are having a great day, and I am so glad you've joined us. I want to talk for a little bit about the Pareto Principle. The Pareto Principle is a really interesting principle that I think you will find has great applications to behavioral health. And so right now, the two people that you see on the screen, the top person is Vilfredo Pareto. As you can tell from his name, he was the one that invented this principle, and it bears his name. So in the early 1900s, he noticed he had a garden, and he noticed that in his garden, his pea plants, he had that 20% of the pea pods in his garden produced 80% of the peas. And then he looked around and he noticed the same thing, the same distribution in another area. He noticed that 20% of the population in Italy owned 80% of the land. And so that became the 80-20 principle, or the Pareto Principle. And after that time, lots of people kind of found the 80-20 principle and the Pareto Principle. And one of the most well-known is the guy on the bottom, which is Dr. Joseph Juran. And Juran is known as bringing this to quality improvement principles. He found that 80% of problems with products were caused by 20% of the production defects. And he found that by focusing on and reducing the 20% of the production defects, overall quality could be increased. So the Pareto Principle is defined to mean that in any group of things that contribute to a common effect, a few contributors, approximately 20%, will account for the majority of the effect, approximately 80%. Dr. Joseph Juran, who we talked about a little earlier, coined this term the vital few and the trivial many. And the vital few is the idea that just a few things hold the greatest potential for making significant improvements in outcomes. And that's the 20% that we've been talking about. And that the other things just don't hold the same potential to make change. Doesn't mean really that they are trivial. They just don't hold the same opportunity to make change in the outcomes. And the key point here is that not everything is created equal. Some things in life, effort, reward, output, are not distributed evenly, and some contribute more than others. And that's what this slide and this chart is trying to show. The red line would be a world where if you gave 1%, you got 1% result, right? The red line shows an effort for a 1-to-1 ratio of effort to results. The green line shows something different, right? It's the 80-20 rule. It shows that some of our efforts mean significantly more than others. Out of 5 things, perhaps 1 is really cool, and that cool thing or idea or person results in the majority of the impact of the group. It would be nice if was like the red line and everything contributed equally, but actually that just doesn't happen. The other thing that's important to note is that it doesn't have to be 80-20. This is just a distribution that we often see, but it doesn't have to be 80-20. It could be 90-10, it could be 90-20, it could be 75-25. The idea is here that everything is not a 1-to-1 ratio. Some things count more than others. And so the other thing that's important to note is it doesn't have to add up to 100. And so these are important things to know about the Pareto Principle. So there's been a whole lot of different applications of the Pareto Principle over time, and it's been used in a lot of different sectors. So for instance, in technology, 20% of bugs in the system contribute to 80% of crashes. And so the idea is there, if we can find those 20% of the bugs that are causing all of the big problems and all of the crashes, then we can drastically decrease the amount of system crashes that we're having, but we're only having to fix 20%. The workforce, 20% of workers contributing 80% of results. And so one implication there might be that we're going to go and focus on those really high-performing workers. There are other examples from other areas. Sales, for instance, 20% of the sales reps generate 80% of total sales, or 20% of customers account for 80% of total profits, or 20% of patients accounting for 80% of healthcare spending. And all of these have different implications for our work, but really beginning to focus on the vital few becomes of great importance. I now want to take a few minutes and show you a behavioral health example. The Pareto Principle is very applicable to the work of those in prevention, treatment, and mental health. And so the slide in front of you includes data from the 2016 National Survey on Drug Use in Health. And the slide is showing where individuals who misused prescription pain relievers in the past year obtained those substances. So where did folks get those substances that they misused, those prescription pain relievers that they misused? So this is a Pareto chart, and the first step in making a Pareto chart is ordering the data in descending order, then using a bar graph and a line graph, and you'll see both to show the individual and cumulative effects. So the numbers on the left-hand side of the screen relate to the individual effect of each of those sources. So we know that about a little over 40% of people who misused prescription pain relievers in the past year received those from friends or relatives for free. We know that a little over, maybe about 36% of people that misused prescription pain relievers received that from a prescription from one doctor. So if we take those two contributing factors, then we can see that about 76% of folks received their prescription, who misused prescription pain relievers, received those from those two sources. So if we were going to come up with a prevention plan, we would want to focus our efforts on those vital few strategies. Those are really the root causes of where folks are getting at the source for prescription pain relievers. And so they give us a picture into, you know, our plan is going to focus on this, and our strategies are going to fall out of that. So those are going to be different strategies than, for instance, working with enforcement on drug dealing for prescription pain relievers, because that's really not the main source of these substances. So while enforcement might be really important in another context, in this context, we might want to think about our strategies a little differently. Okay, and the next slide is some data from the TEDS, or the Treatment Episode Data Set from 2013. And it's about the primary substance of abuse among those that were admitted into the publicly funded treatment system. Again, this information is organized into a Pareto chart. And the chart shows that a few substances of abuse, in this case alcohol, heroin, and other opiates, and marijuana, are the greatest contributors to treatment admissions. The remaining substances, including cocaine, benzos, etc., are far less prevalent. This slide has implications again for our planning efforts for substance abuse treatment and prevention. By focusing our efforts on the vital few substances of abuse, we can really begin to ask ourselves some questions. So, have our treatment modalities caught up to the current substances of abuse? Are our prevention strategies focused on the right substances? All right, so a few implications for the Pareto Principle. The idea with the Pareto Principle is to focus our efforts on the vital few to ensure the biggest impact. If we really want to get our biggest bang for our buck, we're going to focus on those vital few because it will have a larger impact and more possibility of really moving the needle. Also, we're going to lead to tangible success more quickly because we're going to really focus on the critical areas. Finally, it really provides a method for knowing when you have, quote, enough data. Oftentimes when folks are engaging in needs assessment, they ask, when do I have enough data? How do I know when I've looked through enough and really understand? And what the Pareto Principle teaches you is it's when you really understand the root causes. So now we're going to spend a little bit more time talking through a great case study of when this was used with one community and the planning process that one community used that uses this Pareto Principle. And I'm going to turn it over to Lori.
Thanks, Angie, and good afternoon. One of my favorite real-life stories of the Pareto Principle in action involves an effort by what was at the time known as the Genesee County Community Mental Health Agency in Flint, Michigan. Just over a decade ago, they were working to form a new community coalition, and they invited me to come help with coalition and community infrastructure development. If you're familiar with what Flint and the surrounding area has been through, then you can probably imagine what an intriguing challenge that was. And if you're not familiar with Flint, you soon will be. So I'm particularly happy that the leaders of that effort, Christy and Lisa, are here to tell the story of how a community mental health center turned $180,000 in time-limited grant funding into an estimated $20 million in community savings due to saved lives, reduced injuries, and reductions in crime in just 1 year. In the process, they dramatically improved relationships within a very divided community, and they fundamentally changed how community agencies and members come together to solve problems. So regardless of whether you work in substance abuse or mental health or prevention, promotion, treatment, or recovery, I think you'll find that the story of how they use data to identify and target the vital few causes driving a priority community problem has universal applications to the work that you do. So Christy, tell us about Flint and Genesee County.
Thank you, Lori. Good afternoon, everybody. Flint is known as the Vehicle City, and I'm just going to give you a brief overview that doesn't really give it justice, but just a little history lesson. In the 1950s and 60s, the city of Flint's prosperity and influence were at their height. The population peaked in 1960 at almost 200,000 people, making it the second largest city in the state of Michigan. There was flight to the suburbs after that, but Genesee County stayed strong in population through the 70s and 80s. There was extreme economic dependence on one organization, that being General Motors. If you didn't work for General Motors, you most likely worked for a company that was tied to GM as one of its suppliers. Or you may have worked for a small business that serviced people who worked in the plant, maybe nearby, or a large business like a hospital that took advantage or that benefited from all of the people with great insurance. People that worked for General Motors had high wages, and there were high rates of employment in the community. If you've ever seen any of Michael Moore's films, Flint's challenges are either the main or a subplot. And if you're interested, GM plant life in Flint, including much alcohol and drug use, was also chronicled in the book Rivet Head. But jobs in that auto industry paid very, very well, and folks had extremely good health insurance benefits. And for those that did have substance use disorders, for example, 28 days of residential substance use treatment was a standard benefit.
And that was per year. I remember you telling me about that, Christy, on my first trip to Flint, and I was really struck by it. It struck me as odd, but I really didn't understand the significance of it until later. Now, when I began working with you and Lisa in 2007, the national recession was just getting started, but the recession in Flint and surrounding communities was already well underway. The decline of the automobile industry and GM's massive downsizing hit Flint and Genesee County really hard, didn't it?
Absolutely. The city sank into a deep economic depression after General Motors significantly downsized its workforce in the area from a high in 1978 of 80,000 people that all worked for General Motors directly to under 8,000 individuals by 2010. I mean, one example is there was one plant that they called Buick City that was actually 10 miles long, and they called it Buick City because it had its own zip code. From 1960 to 2010, the population of the city of Flint dropped nearly in half. And in the mid-2000s, Flint became known for its high rates of unemployment, poverty, communicable and chronic disease, and high crime rates. It was repeatedly ranked among the most dangerous cities in the U.S. and a few times was actually #1.
I remember when I was getting ready to come to Flint for my first trip, and I had been in distressed areas before, so when you began to give me all of my instructions and precautionary notes, I originally didn't pay a lot of attention, but you were like, I remember you being like, you know, listen, Lori, listen up. This is what you need to do. When you come, you don't stay in the city. You stay in one of the outlying townships. And when you head into town, put your purse in the trunk. Lock the trunk, roll your windows up, lock the doors, don't stop anywhere, come straight to the agency. When you get to the agency, the security guard will be watching and he'll make sure you get in safely. I had originally assumed that the high rates of substance abuse in Flint and Genesee County were tied to unemployment and hopelessness. But what I came to understand was that the prevalence of addictive disorders there had actually been structurally embedded in the economics of the community, and specifically GM and the automobile industry, but kept in check by health insurance that provided significant annual access to treatment.
Yes, factory work is hard. It's hard on the human body. Some people self-medicated for that, but as I also alluded to, high salaries and frequent overtime contributed to much recreational use that also results in substance use disorders for some. And I had mentioned 28-day treatment stints being fairly commonplace, and it wasn't uncommon for individuals to have more than one or multiple of those in 1 year. I was told in the mid-'80s when I was working as a counselor that sometimes workers went to the very nice programs in sprawling county settings just for a break from work.
Yeah, and this is Lisa. Welcome, everyone, and thanks for having me on. But the substance abuse and addiction was one of the most complex social and public health issues that we were really facing. It caused a lot of other issues to arise in our community, and so not just the severe economic deprivation that was happening, but also the loss of health insurance and other benefits, like Christy said, led to addiction and depression and mental illness, where people were self-medicating. The homicides, and other violent crimes increased. We saw an increase in gangs around the communities. Our high school dropout rates were on the rise, as well as Genesee County in general was the second highest county in Michigan regarding teen pregnancies.
In 2007, the state provided our agency with Strategic Prevention Framework State Incentive Grant, or SIG, funds from the federal government. to design and implement a comprehensive substance use disorder program initiative because of all of those issues that Lisa just described. Two stipulations that came along with those funds was that we conduct a needs assessment and address one or both of two issues that the state had identified as priorities: underage drinking and alcohol-related traffic crashes.
When you reached out to me to see if I was interested in helping with coalition development and strategic planning, I recall you were working to convene as broad-based a coalition as you could, and I remember what a challenging task that was given all of the issues and the fragmentation in the community.
Yeah, you know, at first we really did. We struggled to get involvement from various sectors of the community, and so what we did was we aligned ourselves with an existing community collaborative group that had a variety of members, including social service agencies, business people, hospital staff, insurance plans, United Way, and many others. And so our coalition then became a subcommittee of the Genesee County Community Collaborative. Then we kept inviting community partners in different sectors until we had a good core group of individuals that were really committed to the project. And from there, we added structure to the coalition by developing our vision and mission statement that you see here on your slide that really helped us focus our efforts on what we wanted to do.
And while you had lots of different sectors represented on your coalition, Lisa, there was one member early on that played a particularly critical role, I recall.
Yes, and that was Hurley Medical Center. Specifically, their Department of Research was a key community partner and actually a neighbor across the street. They led a comprehensive needs assessment process for us. They analyzed reams and reams of local, state, and federal data. Especially important was exquisitely detailed Michigan Office of Highway Safety Planning data that we learned had down to the intersection, how many individuals were in the vehicle, et cetera. Incredible data that we were able to use for our project. They assisted us in the coalition in identifying gaps in the data as we went through it and conducted surveys and focus groups to help fill those gaps, such as with physicians, law enforcement, college students, and later on with servers from retailers and from bars.
I remember, Christy, that you all spent so much time assessing. I started to worry that you were going to run out of time to finish and implement your plan. But, of course, that didn't happen. But another thing that we did in Flint was a community system assessment. The problems in Flint and Genesee County were so complicated, and the roots of them were so deeply embedded in so many different sectors and disciplines that we talked about the problems in terms of a syndemic or a system of synergistically linked epidemics. We knew that the solutions were going to require coordination and partnership across multiple sectors. So in addition to the needs assessment, we also engaged the coalition in a structured assessment of 3 key areas for organizational effectiveness. And these are areas that are important regardless of the type of problem that you're trying to solve, and that's distributive leadership, adequate capacity, and the use of effective processes. We convened community members and agency leaders for a day of discussions about these 3 areas, which were broken down into a number of sub-areas. So the coalition's task was to move through the assessment by discussing the indicator under each sub-area, and you've got a snippet of that on your screen, and to identify the degree to which they felt it currently existed among the community, using a scale of 1 to 10, with 1 being low to non-existent and 10 being high. Then they were to assign each indicator with a priority level. A, being something they felt they needed to address immediately in order to be effective. B, being something they felt either could or needed to wait until a little later. And C, being something that they didn't feel a need or readiness to tackle until into the future. There was also the option to categorize something as an AB, meaning we need to do it now and we need to do it in the midterm. A BC priority meant we need to start this in the midterm and continue it into the future. And there were some things that they ranked as ABC, meaning we need to start working on this now and we need to keep it on our radar screen always. Now, when people come together to create change, they frequently jump to action and strategies without adequately assessing and planning for important organizational or system conditions, things like political will or inclusion of the coalition, influence and accountability. So this is always an interesting discussion, and sometimes it's the first time that people really come together to talk about these things in a structured way. In Flint and Genesee County, there was so much fragmentation and so many issues jockeying for attention that it was a little challenging to keep people focused on the community as a whole and not focused on individual organizations or agencies. That's not unusual, and it's why we always recommend an outside neutral facilitator for this process. But when the coalition members and leaders did focus on the overall community, they came to consensus pretty quickly on just about every indicator.
Yeah, and initially we were really disheartened by how low the scores we gave ourselves were.
And I remember reminding you all that that's typical when you're just starting out, and that where you end up is way more important than where you start out. Out of the 85 indicators that they discussed, they prioritized and came up with 33 immediate priorities. So we reconvened a second time to prioritize the priorities. Out of the 33 courses of action that they could potentially take, they selected the vital one that they felt was both achievable and critical in the near term, and this informed the goal of their coalition development plan.
Yeah, we really wanted to look at what would make the most impact if we addressed that. And so the goal we selected was to increase the active involvement of key stakeholders from all sectors in the work of the coalition. The objective associated with this goal really identified 5 specific groups. So we talked about getting law enforcement involved and school personnel, faith-based, the court system, and youth.
But of those 5 sectors, however, it was our law enforcement partners that would play the most critical role in implementing our first initiative.
So the next step then was to take everything they had learned through the assessment process and identify the priority substance abuse related problems that they wanted to impact, as well as the populations that were most affected by and involved in the problem. And I remember stressing to don't fall into the laugh trap when you do this. The most critical and common pitfall to avoid at this point of a planning process is we call it the lack trap, because when you describe a problem as a lack of something, it leads you right into a course of action to fill the lack before you've really finished your analysis or thinking through the problem. And I think it's probably the most common reason that people miss the vital few among all the potential courses of action they could take.
Yeah, but as we were looking at our data really confirmed that underage drinking and fatalities and injuries due to alcohol-related crashes were significant issues in our communities. And so our strategic plan then included a goal for each of those problems. But we had to decide which goal we would tackle first. Within the state-mandated priorities, really, which populations did the data support us addressing?
And I wasn't involved in this prioritization process, but given that the majority of the coalition's discussion that I had been part of had focused on youth and the poor life outcomes and the concern about substance abuse among youth, I was pretty certain I knew what problem they were going to pick. But I was wrong.
Yeah, we chose to attack alcohol-related traffic crash deaths first.
And I remember asking you all how you had prioritized this issue.
The coalition was concerned about youth, yes, but there wasn't widespread community consensus about how to approach underage drinking. We also didn't at that time have great data on youth, and we had limited partnerships with the schools, which were overwhelmed with lots of other issues. We had excellent data, on the other hand, on the alcohol-related crashes. There was consensus in the community about the issue and, importantly, the political will to act. And we were working on partnerships with law enforcement that had the capacity to act. The community was divided enough. We really needed an issue that would bring everyone together.
And I remember this conversation with you both so clearly because it really profoundly underscored key principles of problem solving. First, pick a problem where you have sufficient data to thoroughly diagnose and understand it. And two, start where there's political will and capacity and readiness to act. It was also a good reminder to me that local people solve local problems best, because I have to admit, I was surprised by your choice initially, although you made me a total believer in the process. So you had been working hard to cultivate partnerships with law enforcement, which at that time, I recall, consisted of about 17 different, very somewhat siloed and very stressed city, county, and state jurisdictions that didn't really have a history or a process for coordinating their efforts.
Yes, that is absolutely the case. This was challenging initially. It was a new sector for us. We had strong criminal justice system relationships in the courts, including drug and sobriety courts, the probation department, community corrections, et cetera, but not with the police departments. And it actually grew from one referral initially, actually from our COO, that had gone to a state-level meeting, met a local police chief. He sent his lieutenant, who referred a lieutenant from another department. He referred a particularly energetic Michigan State Police sergeant that specialized in crash reconstruction. The jurisdictions then came together because of this issue that the coalition had chosen. There was great synergy with this issue that they had also identified on their own. So as it played out, we had these resources from the feds through the state, and they had this passion and the staffing available to address the issue.
Now, when you looked at geomaps of crash data, I remember that you found in Flint, they primarily clustered along a particular corridor.
Yeah, and so when we were looking at our data, we were really trying to find, this hot spot, if you will, of what was happening in regards to alcohol-related crashes and fatalities. And so we found that there was a disproportionate amount of alcohol crashes that involved not only drinking drivers, but pedestrians that were intoxicated, as well as bicyclists that were intoxicated. And so on this slide, you can see all of the many accidents that had happened in Genesee Township, which is just north of Flint. And so specifically along what law enforcement at the time called the Dort Highway Corridor. And as you can see on the slide, we also saw several crashes circled at the corner of Saginaw Street and Stanley Road.
And I remember that initially there was a focus on out of data, young males ages 21 to 24. You had identified as primarily being the drinking drivers. And I recall a coalition meeting where somebody brought up the use of sobriety checkpoints. And there was some frustration because that seemed like a perfect strategy to you all, but in Michigan, they're not allowed because they're considered unreasonable search and seizure. And so as I listened to the discussion and the frustration, it occurred to me that your goal was to reduce deaths, but your target population focused solely on drinking drivers. And so I asked you who was dying. We knew who was drinking and driving, but who was dying?
Yeah, and we didn't know.
So we went back and did some more assessment, and what we found surprised us.
And it surprised me too.
Yeah, while just under 2/3 of those who were dying were people who had been drinking, nearly 1/3 of them were drinking pedestrians and bicyclists. We then began looking at the factor that tied those three populations together.
And what we suspected was that it involved sales or over-sales, over-servicing of individuals that were already intoxicated or soon to be. So backed by the data and with great enthusiasm from our new police friends, we started investigating what was happening on that Dort Highway corridor.
And it was a wonderful illustration of the dangers of jumping to strategies, because had sobriety checkpoints been legal and not been an option, there would have been a whole third of that population that probably wouldn't have been addressed by that strategy. And I remember that you used a mix of different kinds of data to identify all of the factors that contributed to this problem.
Yeah, we really tried to put together a comprehensive approach to cover every factor based on our review of the assessment data, as well as our discussions in our coalition meetings and focus groups that we held with key informants throughout the community.
And many communities would have focused on attitudes or norms. They might have relied on media or norming campaigns as a primary strategy, say placing billboards about drinking and driving along the Dort Highway. Some might have focused primarily on drinking and driving education for offenders. You did ultimately include media and norming, but you did so only as supportive activities to other actions which really focused on the heart of the problem.
Yeah, when we looked at the data, it was clear that to make an impact, we had to directly decrease on-site and off-site sales of alcohol to persons who were intoxicated or close to becoming intoxicated. I mean, this factor had a stronger impact on the problem than probably all of the other factors combined.
It was the vital few, to quote Angie, among an array of many possible courses of action.
Yes, and one other really important note that I want to make, as is true in many or most or all projects possibly, it's so important that we were able to target this issue because we had very strong support from the top levels of our organization. Our CEO, COO, there was broad-based community support through the coalition also, as has been described, and incredible partnerships with law enforcement for whom this issue was a real priority.
And even with all that in place, I remember you were nervous about aiming for a 20% reduction in 4 years.
Yeah, we were a little ambitious, and so we were worried that we might be aiming too high. We didn't want to not achieve our outcomes. I mean, we wanted to make sure that what we had was realistic and achievable.
So you entered into a partnership with the Michigan State Police Fatal Alcohol Crash Team and local law enforcement agencies. Now, this was a new model of creating change for you, I remember. In the past, you had described that your prevention efforts had focused primarily on funding providers to do presentations in school-based curriculums.
That is absolutely correct. This was a real departure. We provided $180,000 to pay for overtime for officers from these various departments to conduct expanded Liquor Control Commission inspections to outlets along that door corridor and then across the city and county. In the past, these inspections had been sporadic across the 17 different departments. Some had grant funds, others had never ever done it before at all. But none were ever as comprehensive as the ones that we conducted through this project. But when Sergeant Robbins of that FACT team reviewed state law, he found they had significant leeway to conduct much more comprehensive inspections, so that's what they did. And those initial inspections, though, were intended to be educational in nature and to build relationships with the retailers. But some of the things that were discovered during the inspections ended up making it a little difficult for the officers to simply educate. For example, there were items discovered like guns, including a sawed-off shotgun under the counter, bags of marijuana in drawers, and other safety and health violations. They actually took me along in Kevlar one time to experience the process firsthand.
Yeah. And then later on, we also funded operating while intoxicated stops. And so we had one law enforcement agency that agreed to be the coordinator of the project, and so they used our funding to pay, again, for overtime for extra police officers to be on the streets looking for suspicious driving or drivers who might be under the influence of alcohol.
And so while the coalition represented many sectors, which ended up being very important later on, only a small percentage of the members were actually needed to carry out this part of the initiative. I think it's another good example of the vital few.
Yeah, and that was something that you taught us. I mean, the coalition members aren't just those people who come to our meetings, but some of the most important members may never come to a meeting, but they can still carry out incredibly important functions. And that's one thing that we learned that really helped with our relationship building with our law enforcement partners specifically.
So, Christy, as you described, the results of the inspections turned up some surprising results. Although in hindsight, this probably makes perfect sense given what we know about the nature of syndemics and how problems tend to be tied together.
Yeah, and as the police got out there, you know, it wasn't surprising. They found many outlets that were engaged in illegal sales of alcohol were also engaged in other kinds of illegal activity.
Yeah, surprise, surprise. In the lesson learned category, I think it's important to also share that one of the things that happened that perhaps should have been anticipated, but we didn't plan for it, was suddenly we started receiving many, many calls from extremely irate bar and store owners in the community. And those calls were going to city council people and county commissioners, our CEO, and board members. It was kind of a big oops. And so we said, okay, we need to fix this. So we ended up doing something that we, in retrospect, should have done at the beginning of the project, which was to send a letter to retailers and bar owners explaining what we were doing and how we wanted them to be part of that process. So we sent letters letting them know what we were doing and why. And then we had our Hurley Medical Center research friends and colleagues conduct the focus groups with servers from bars to ask them, why are you over-serving folks? And with also store clerks in the same way. This resulted in the store owners being sent invitations to some breakfast meetings where we shared the data from those focus groups with them.
Yeah, and those went really well. I mean, we also had a specific retailer meeting to focus on our media campaign that we wanted to do. And so the owner's feedback really helped us tweak our media campaign. And so we were looking at doing something around drinking and driving, but they agreed to put our materials in their establishments if we highlighted instead designate a sober driver. And so we still had drinking and driving as a gamble with too much to lose as part of our message, but we really highlighted the designate a sober driver. And so we were able to make coasters and posters and even had urinal screens that included facts around drinking and driving. We had a taxi cab company number on there so that they could have alternative ways to get home, and also those coasters and posters included reasons of why not to drink and drive, like losing your license or, you know, having to go to civil court. And so things that really were going to be impactful to the population that we were trying to get the message to. But those retailers were able to give us feedback on that campaign material, and which made us tweak our material and helped us in the end build our relationship with retailers across the county.
And through us listening to them, yes, they became important community partners as well, like Lisa described.
And then a third component of your course of action, and you've kind of alluded to it, involved preventing, preventing overservice of alcohol to persons who were intoxicated. And you had a couple of key strategies there.
Yeah, and so we really looked at what do we need to, after the focus groups and all the other data that we were looking at, what are some things that we can put in place? And actually the retailers were one of the ones that also had suggested doing beverage server training for their staff because it was costly, and you know, there was a high turnover sometimes with staff. So you might have a bartender here this week and gone next week, and you've just paid out, you know, $75 to have them go through beverage server training. So we partnered with an organization that gave us a deal and came in and did beverage server training for us with bartenders, servers, clerks, etc. During that time frame, we trained around 700 individuals in the techniques for alcohol management. But then in addition to that, how we alluded earlier that we were doing these inspections with the retailers, we also wanted to train local law enforcement officers in how to do those inspections. And so the Michigan Liquor Law Enforcement Training Seminar, we brought that in, and we were able to train 100 local law enforcement officers. And in exchange for that, then we wanted them to do some underage drinking compliance checks as well as the Michigan Liquor Control Commission inspections.
So your end result was phenomenal and well in excess of that goal that you worried, that outcome that you worried was maybe overambitious. Tell us about that.
Yeah, we reduced alcohol-related crash deaths significantly in just 1 year. We were so excited about how all of our strategies worked together to really impact this issue that we saw in our community. And as you see on the slide, that from 2008 all the way to 2011, we saw a large decrease in the percentage of alcohol-impaired driving deaths in Genesee County. And then the percentage of deaths increased a little in 2012, but not to the level that they were in 2008. And then 13 and 14, you know, we saw another decrease in the percentage of alcohol-impaired driving deaths. So the drastic changes in percentages of alcohol-impaired driving deaths that were noticed here were not noticed over the state in general or in the United States, so the green and the red lines there. So we were so excited that it worked.
Absolutely. We could not have been more thrilled. And again, that's as a unit, all of those community partners together. We were just absolutely ecstatic. And one of the really nice things that happened as a result was that we received the 2009 Traffic Safety Achievement Award from the Michigan Governor's Office, the Governor's Traffic Safety Advisory Commission, for our coalition's success in reducing alcohol and drug-related traffic fatalities and serious injuries in the Dordt Highway area.
And I remember Sergeant Robbins, who headed up the Michigan State Police FACT team, reported that the $180,000 that you had invested in overtime, combined with the other efforts to reduce overservice and sales, resulted in an estimated more than $20 million in community savings due to decreased deaths, injuries, and crime in that year. And that's more than a $10,000 return on investment, which is pretty phenomenal.
Yeah.
Another thing that we saw, we reconvened the coalition 18 months after that original assessment, where they had discussed those 85 indicators, prioritized 33, and focused on one. And what we found was that they reported significant growth, even though they had focused on one indicator that I thought was most important. You can see in this snippet that from 2008 to 2009, the community members reported significant improvements in how they saw themselves and felt they were in terms of functioning in almost every area. And that was pretty phenomenal as well. But there was one area of community growth and relationship building that turned out to be particularly important.
Yes, absolutely. Our law enforcement, we were just so thrilled when we heard this, that our law enforcement partners told us, and this was from many of the different jurisdictions, that they had never really communicated as effectively across those jurisdiction lines, across departments, that our project had brought them together in a way that none of them could remember previously, and created that incredibly important communication that they noted helped them in solving crimes that had nothing to do with the efforts of our project.
Yeah, I think overall, you know, that connection with law enforcement was really key in establishing the impacts that we saw on the previous slides.
Mm-hmm.
Absolutely.
So my colleagues and I have seen over and over again that significant amounts of positive change can be achieved quickly, as little as 1 to 2 years, and often in ways that are not resource intensive, as long as people start where there is consensus and do the things that really matter. Now, that's not to say this is easy work. Genesee County, Flint, spent a year assessing community issues and building readiness and relationships. But when I hear people say that it takes generations to create change, it's a pretty good indication to me that they're either starting with a problem they don't really understand, or they're starting with a problem that there's not readiness or consensus to act. I think the story that Lisa and Christy have told underscores also the power of starting with a consequence rather than a behavior or a causal factor. People may disagree about behaviors, and causal factors, as we've seen, can have varying degrees of correlation with the problem, but people rarely, if ever, disagree about consequences. The data will help you identify the populations and the factors that need to be targeted. And this brings me to a final point, which is that success begets success. Even small wins lead to bigger wins. I spoke earlier about my surprise that the effort in Genesee County chose to focus first on alcohol-related crashes among adults rather than underage drinking. But you know what? When I talked to Christy about a year later to check in and see how and what they were doing, she said, "We're working on underage drinking." It was time, and the community was ready. So in conclusion, I want to thank you, Christy and Lisa, for inviting me to be a part of your initiative a decade ago. And I want to thank you again for coming together with me today to tell your story. And with that, I'd like to ask have Mary Ellen come back in, if she would, to conclude our presentation.
Yeah, thank you for a compelling story and for illustrating the Pareto Principle in action. We've received several requests for a copy of this recorded webinar, and so we are in the process of making that happen, and we'll send that out to all registrants and participants in this webinar. If you are interested in talking with one of our presenters or staff about the right course of action to take, maybe to achieve your own outcomes, I encourage you to email or call us. We have contact information on the slide for both Angie and Lori, staff here with JBS, and I know they'd be happy to connect you with Lisa or Christy, who are also willing to talk with you. If you have comments or questions about the webinar itself, we welcome them and encourage you to email us if you haven't already put the question in the chat. And if you would like one of our staff to contact you, please indicate this in a survey that will appear in a pop-up window once you've closed fully out of this broadcast. So just wait a minute, and then the window should pop up for the evaluation. Thank you, everyone, for your participation, and have a great rest of your day.